it's in the first year, a group of people, students of us were chatting, and we were introducing ourselves. And Dr. Senthilnathan told his father is a doctor. Actually, that is a big thing for us, because as a student with the non-medical parents, that is very great. And we were like, wow, your father is a doctor. Then he told, we own the biggest hospital in our town. Then we became dumbfounded. So they have a biggest hospital. Then he laughingly told, actually his father is a doctor working in a government hospital, which is the headquarters hospital in his town. And he jokingly told like that. It was a funny incident, but now it has actually happened. Dr. Senthilnathan is the head of department of surgery in GEM hospitals, one of the most renowned hospitals in Chennai for surgical gastroenterology. Despite of being reaching many heights, Dr. Senthilnathan remains his same humbles and pick up calls from us and reply. That is the most amazing thing I want to tell about him. In spite of his many professional achievements, that is the most humane thing. Dr. P. Senthilnathan is a head of Department of Hepatobiliary Surgery, Minimal Access Surgery and liver transplantation from GEM Hospital and Research Center, Chennai. He qualified his MBBS in PhD Institute of Medical Science and Research Center, Coimbatore, and he got his post-graduation from Coimbatore Medical College and DNBA also from Coimbatore Medical College. And he passed out MRCS in Royal College of Surgeons, Edinburgh. He has done his DNB and he has finished FACS, American College of Surgeons, Fellow of Minimal Access Surgeons of India, Fellow of Association of Surgeons of India, many more degrees to his kitty. He is currently holding the academic divisional head, Department of Hepatobiliary Liver Transplant Minimal Access Surgery in GEM Hospital, Chennai. He is part of Organization Committee, Asia Pacific Laparoscopic Hepatectomy Promotion and Development Expert Committee, and he is treasurer of Association of Minimal Access Surgeons of India. He is a member of Executive Committee of Surgical Gastroenterology, Indian chapter of International Hepatopancreaticobiliary Association. His awards and achievements are endless. He has stood first in Tamil Nadu MGR Medical University final MBBS exam in 1998. He has got the Young Investigator Award in 14th World Congress of Endoscopic Surgery held at Chennai, Oklahoma. He has got gold medal in DNB surgical gastroenterology. He was the first surgeon to perform a live laparoscopic Whipple surgery, which is a very difficult surgery. And he has got Best Paper Award at World Congress held in Brazil. He has got the Best Poster Award in a conference held in 2017 Japan. His areas of interest are hepatobiliary pancreaticosurgery, minimal access surgery, liver transplantation, and he has been author in a few textbooks. This is very amazing. We didn't know that. Surgery for cancer of the gastrointestinal tract, step-by-step approach, laparoscopic pancreaticoduodenectomy, and pancreaticojejunostomy, art of laparoscopic surgery. He has been a regular faculty in national and international conferences in the field of surgical gastroenterology since 2008. He has rich academic and operative experience in various skill courses, workshops, and conferences. Actually, I know many doctors have to wait for his appointment for surgeries. I know personally. He has been lecturing all over the world for the past years. He has given orations in many subjects. He has organizational experience and organizing committee member for various conferences. His his papers published in umpteen number of journals in Indian surgical gastroenterology in American and British journals, and if I have to list all these, it will take another half an hour. So I will finish with this. Thank you, Dr. Senthilnathan, for being here despite your busy schedule, and we are waiting for your experiences. Thank you.
Shall I start?
Yes.
Good evening to all. First of all, thank you, Dr. Ramya Dinesh Babu, for giving a wonderful introduction. No one has given such a wonderful introduction to me, starting from my MBBS days. That's about being a long-time friend, so that we can recollect all the good things and all the interactions we had. I'm doubly happy that Ramya is doing well in her locality, servicing the poor. So keep it up and good going, Dr. Ramya Dinesh. My next thank goes to Rotabus, a platform where we can share our experiences, share some of the tribulations, some of the hard things which we have done, especially in this COVID pandemic. And you continue to operate in online platform so that whatever the message that's being conveyed here will reach to the public. So including the chief guest from Sri Lanka, the past president, the president, the governors, district governors, and all the people, all the Rotarians, fellow Rotarians. And again, doubly happy that being myself a Rotarian, sharing my experiences in a Rotary platform, and for that I'm doubly happy. And also from a doctor's point of view, as Dr. Ramya Dinesh said, it's very important that we have to convey some of the messages through noble people, noble souls like you to the public. In fact, I don't know whether Dr. Ramya saw my slides or not. It was exactly the same thing. Everything was going on well till recently, but then now we had tough times in managing the patients as well as managing overall COVID situations. So in this, to share some of the experiences which we are undergoing as a medical fraternity, I think this talk will throw some light. I'll share my screen. Dr. Ramya Dinesh has introduced me. Before this pandemic, I was purely an academician and a surgeon, concentrating less on the administrative purposes. I'll in the end acknowledge few of the people who have been after me, who have contributed a lot in preparing this particular piece of talk. So I'm totally, till this particular few months back, I was into surgical practice, both academics, operative techniques, as well as writing papers. That's my full-time job. Last 3 months, you all know, our life have completely. And I also forced to look into how our healthcare works, what are the difficulties which we face. So this is in a nutshell, both a personal as well as overall view, especially from Indian perspective, the challenges which you have faced and how to overcome those challenges which are facing the hospitals in a COVID situation like this, in a pandemic situation like this. I begin my talk by acknowledging as well as mentioning the sacrifices made by all the healthcare workers, including the doctors, nurses, paramedical staff, who have sacrificed their lives during this COVID pandemic. Sacrifice happened, is happening, and is going to happen knowingly and unknowingly. And not only the healthcare workers, I also should acknowledge the fact that all the people who are working for the betterment and also for the eradication of the COVID pandemic, like the sanitary workers, the police officials, as well as the government officials who, like the healthcare workers, work day and night, putting their lives at risk for a better tomorrow. So I start with a tribute to all people who have involved and who have sacrificed their life for a better tomorrow for us. You all know the COVID story so far. Starting from January 30th, now we have crossed 5 lakh cases. And unfortunately, all the predictions, either by the university or by the ICMR, is now turning into a reality. When the first few of uh, the studies, few of all these models came in, we said, we hope that it should not be true. But unfortunately, our graph continues to grow. And more worrying feature is we have not seen the plateau, we have not seen the downward trend. It's still, as you can see, the trend is continuing. And more worrying from a local point of view is in Tamil Nadu, like in Maharashtra and other states like Delhi, we also, this is the patients affected per million population. That's on the left side of the screen. So Tamil Nadu has one of the high patient count, and it continues to rise. Today, Chennai has more than 2,300 patients, and close to 4,000 people are affected in Tamil Nadu alone today. And that's the trend we have been seeing in the last few days. It's a very worrying trend. Before I go and try to explain what are we doing during this corona pandemic or COVID pandemic, in a few slides, we need to understand our health system. I'll continue to talk in English. Probably in the little later, I might talk in Tamil, because all the audiences are from outside Tamil Nadu, outside India. So I continue to talk in English. So, the healthcare, basically, as you can see, we spend less. As a proportionate of our GDP, it's less than 5%. It's around 2 to 3%. That's the percentage of GDP or the total healthcare cost we spend for our own well-being. This compares very unfavorably with that of the Western world, where anywhere between 12 to 18% of the whole GDP is spent on healthcare. This slide shows that the budgetary allocation or the spending capacity is less with regards to our healthcare system. If you split that healthcare spending into state-wise scenario, it doesn't differ much. If you can see in the last these are all the data taken from the state budget documentations. So these are the genuine data I'm speaking about. Even in Tamil Nadu, you can see it's about 3% of the GDP or the expenditure on health by states as percentage of total budget. Most of the states have less than 5% of their total budget spent on health. So that's again a worrying trend. We are sitting on such a less spent area even before COVID pandemic. So that's our healthcare scenario even during normal times. Okay, the next thing is our healthcare system basically differs from the rest of the well-developed nations in the sense, unlike those nations like the European or the US, here we see almost 75% of the healthcare delivery is by the private hospitals. It can be clinics, it can be nursing homes, trust hospitals, medical college hospitals, and corporate hospitals. About 25% is by the public hospitals. It can be a primary health center, sub-center. It can be a government medical college hospital, or some centers of excellences like AIIMS or Madras Medical College or JIPMER Pondicherry. So put together, government plays about 25% of the healthcare delivery, whereas the private put together has contributed nearly 75% of the healthcare delivery in India, which is not the case in other West developed nations. Other thing is the cost of the healthcare. Here I'd like to deal a little bit more in detail. We all think that our healthcare system, our healthcare cost is more. It is not. Definitely, it is not. When compared to the Western countries, developed nations, our healthcare cost is still much less. I can go on and say to the extent it is definitely less than 20% of what a good healthcare cost in Western like countries like in European countries. That leaving apart, majority of us are paying from own pockets. The insurance companies are less, whether it is public or a government insurance. And if you look at the proportionate of the expenses people spend on the healthcare, it is not the hospitals, it is not the doctors, it's the medicines that contribute to majority, more than 50%. If you look at the right side pie chart, it says that more than 50% of the money spent on the healthcare is for buying medicines. Contrary to the belief that private hospitals take a major chunk, it is not so. So people, basically what I'm trying to tell is people spend from their own pocket. Insurance coverage is very less, though we have now things are getting brightened up, especially with Prime Minister's Pradhan Mantri's Yogna scheme, as well as even before Tamil Nadu is forefront, I can say, Chief Minister's comprehensive insurance schemes. These are bringing the things to a better end, but nevertheless still a long way to travel. Predominantly it's from the out of pocket, predominantly spent on medicines. Private hospitals, paying to the private hospitals is less than 25%, and patients spent on diagnostic tests also contribute to about 10%. So this is the overall healthcare system of the Indian. And at the same time, looking from the infrastructure point of view, looking from the quality of health, I can proudly say that in the last 20-25 years, we have developed our own infrastructure to match that of the rest of the world. I'll tell it in Tamil. முதல்லலாம் நான் சின்ன பையனா இருக்கும்போது ஒரு பெரிய ஆப்ரேஷன் பண்ணணும், ஆர் ரொம்ப பணக்காரங்க வந்து சர்ஜரி பண்ணணும் அப்படின்னா they will go to Singapore, they will go to America. You take actors, actresses, celebrities, they generally go to developed countries like Singapore in the East, or Japan, or to Europe and the America in the West for getting quality treatment some 30 years back. Now I can say it's the reverse thing happening. They are coming here to get treatment because of the good infrastructure, because of the expertise available, and because of the guidelines we could able to develop on our own. I put randomly two important articles and the statements. We were developing one for pancreatic cancer, the other one for the esophageal cancer from Gem Hospital. So these are some of the I can say the tip of the iceberg, that the quality of work that's happening in India, I can say, is second to none. But at the same time, you will be wondering, I have already told the cost is less. The main reason for that is because the cost depends on three areas. One is the infrastructure, the other one is the consumables, the infrastructure like the hospitals, we call it as establishment charges. The second one is the consumables. The third one is the manpower. Two things are basically non-negotiable, because we cannot tinker with that one. Infrastructure cost. We cannot build a hospital inferior to the developed nations. So our infrastructure cost is fixed. Consumable costs are also fixed. Machines. Even now we depend on the importing of all the quality machines to perform or to give quality healthcare to the public. What we are scoring is the manpower cost. Whether it is the doctor's salary or nurse's salary or the paramedical salary, out of the three, roughly it constitutes one third, one third, one third. Establishment charges like the hospital infrastructure, the consumables, and the third one is the manpower cost. Manpower cost is approximately one third. That we could able to reduce it. When we compare to the rest of the world, our hospital, the doctor's salaries are less, staff salaries are less. Even I can say compared to the rest of the field, the healthcare is the most underpaid job, I can say. I'm trying to equate as close to the agricultural labors, because agriculturists produce the lives, all the food stocks, but they get paid less. Likewise, the healthcare people who are delivering the healthcare are paid less. That contributes to the low healthcare cost in India, because the two variables are not going to change. One is the establishment charge, other side is the consumables and the machines. Machine, if you want to import from Germany or from US, it's the same cost. We pay it in dollars. But where we score is less, manpower cost. Imagine, but fortunately or unfortunately, manpower cost has been at bottom line. A nurse who completes 4.5 years of BSc nursing is paid about 15-16 lakhs, but whereas a BE graduate in a good IT company pays more than 50-60,000. That's the disparity. But nevertheless, we are not complaining. We still happily working there, taking care of the patient. So this is in general overall healthcare scenario in India. About the infrastructure, about the manpower, and about the healthcare delivery systems, as I told you, predominantly private. So till 3 months back, or till 3.5 months back, everything was going on in a normal fashion, because depending on the economic background of the patients, they continue where they seek healthcare either in public or private sectors. Even in private sectors, different levels of hospitals and healthcare delivery systems are there, depending on the economic status, that I have to acknowledge. But when it comes to the handling of pandemic, in fact, Dr. Ramya also will remember, we heard this term pandemic only in our social and preventive medicine during our 4th year of our MBBS. We never thought in our lifetime that we will be able to see such a pandemic. Our last big pandemic was the Spanish flu, you all know, which happened 100 years back. So it's basically, even from our own healthcare point of view, we never thought of such a pandemic will ever experience in the whole world. Coming to our preparation, our healthcare, because of low GDP spending, was not prepared to handle such a pandemic. Even in 2018, as late as in 2018, Global Health Security Index has warned that India is not prepared to encounter any pandemic. At the time, 2018, nobody expected, but their predictions were, if a pandemic were to strike now, India is not prepared because of the inherent healthcare system. And India ranks, as you can see, as low as 57 in managing a pandemic like this, what we are facing. So basically, we are not prepared. Even the developed nations find it difficult to handle it. Our healthcare system really bucks under pressure. But fortunately, because of the lockdowns and the other measures, we could able to have some time to prepare ourselves so that we can face with a little bit more of armory in our hand rather than fight with an empty hand. Again, Dr. Ramya said, all was well in the beginning. In the month of March, in the January 30th, we had the first case. In Tamil Nadu, we had the first case on about in the February, and then by March, we had the entire India is getting patients. But when the first lockdown was initiated, there was a sense of well-being, good positive images about the healthcare workers. In fact, the entire country celebrated as well as acknowledged our good work. We can see we have the Janta Mandir, Janta curfew, as well as people were seeing, clapping, whistling, as well as acknowledging our good work. When the COVID pandemic was under control, not much of disease spread was there in the community, and predominantly limited to public sectors, even public sectors with great difficulty. We have seen a lot of our friends who are working in public sectors, public hospitals. They even now face a lot of challenges like us. But nevertheless, people really started to acknowledge that yes, we are all COVID warriors. People were standing along with us. They were very supportive of whatever the treatment, whatever the steps we as healthcare professionals take. But somewhere down the line, I have to acknowledge also the fact that probably in the last 2 months or 1.5 months, hospitals, especially the private hospitals, were in the news for wrong reasons. There were a lot of complaints about the hospitals charging more, about doctors charging more, about fleecing, and you can see even sting operations creating a sensation. My take in this one is, this is not a time where we should sensationalize the news, especially such a kind of distress situations we are in. I think this shouldn't have happened. But for varying reasons, we get even now lot of, at least daily in the newspapers, in WhatsApp messages, in the media, social media, we get a lot of such complaints that hospitals are there to make money during this one. Is it ethical? Is it correct on the hospitals when the rest of the world is suffering? The private hospitals are making money. They are fleecing the people. They are denying patients admissions. These are some of the exact happenings that in the last month or so. So I need to clear some of the air. What we at the hospital level or at the healthcare level are doing, so that we can, at least from our point of view, we can clear some of the misconceptions and some of the myths, some of the wrong perceptions the public and people like you can spread the message that this is what is happening. Right. Like any other industry, like any other I would say person or any other institution, the hospitals also have completely changed. We have to go for patient safety measures right from the footstep. For that, as you can see, these are some of the pictures we have taken from our hospital, right from the waiting area to the entrance. And as you can see, non-medical staff working in the hospital, everyone has have to wear all the protective gadgets, maintain the social distancing, because among the public places, the hospital has got the maximum concentration of COVID patients. In the public, we don't know who is having COVID, who is not having COVID. But in hospitals, especially those hospitals who are treating COVID patients, they have got the highest concentration of COVID viruses in the environment. And moreover, Center for Disease Control, CDC, have clearly stated that which are all the high risk area and which are all the low risk area. And high risk area are indoors, and hospitals are indoor areas. So the people who are working there, whether it is medical staff or non-medical staff, they have to have proper protection. Whether it is dispensing of the medicines in proper containers, or see, this is on the left side, I am me doing endoscopy. This is the first endoscopy done at Gem Hospital, Chennai. And on the onto the right side, you can see the same endoscopic suite, but the situation and the entire scene is different. People donning the PPEs, hazmat suits, like a space warriors. They have to have all such protections with lot of uncertainties, lot of bugs surrounding us. We are working in it. even in wards, not only the staff, the entire workforce, whether it is the ward helpers or the sanitary workers or the staff nurse or the nursing assistant, the entire team should be trained for maintaining this. Not only the staff and the doctors, paramedical and the other staff should be trained. So it's a complete new normal that's happening in the hospitals. And the operation theater, we have to don the entire PP, personal protective equipments, with all the respirators, protective equipments, and more so it's about not only wearing this, doing surgeries for hours together create a lot of effects on the carbon dioxide retention, on our personal comfort is definitely compromised. So with lot of such disturbances, we are working to save the patients.
We can't see you.
The moment we enter into the casualty, again, we could see the difference. And the contingency plans, say this is the contingency plans at Gem Hospital, Chennai. When our own staff or doctors, fortunately we have not had one, touch wood, but in case if somebody feels sick, we have to have contingency plans, we have to have isolation wards, and this is the preparatory stage for that. So put together, I want to impress you that the COVID burden on the hospital is huge. The rest of the industry, they either close or they work with the social distancing. But here in the hospital, it's a completely changed scenario. Starting from usage of personal protective equipments, the next comes the shortage of the staff. India is traditionally shortage of staff and the doctors, but now staff shortage is even more on attrition. People think that doctors and the staff are paid more, they make money. Rather, the reverse is happening. Staff are just afraid. Doctors are afraid. If they don't have proper infrastructure, they are afraid to come. Imagine one among you who have a relative, your son and daughter is a doctor or a staff nurse. Even in my house, my parents say, Senthil pohada, konja careful paruga. Everywhere, people are afraid to send their wards to the hospital. But in spite of that, in spite of all the criticisms, all the precautionary measures, all the advices from the patient, parents, the spouses, still we operate. Still we come and work. So that itself is a mental burden or mental tension, I would say. And the infrastructural changes, which I said, it has to be a complete makeshift makeover of the hospital. And because of the COVID pandemic, you can see we drawn all the drape all the PPEs. The shift, we cannot work for more than 6 hours, especially in the COVID hospital. So additional shifts, additional manpowers are required. And after treating COVID patients, the doctors as well as the staff, whoever is treated, they are quarantined in a separate facility. It can be the hostel or the hotel or any other facility. We have to provide them the quarantine facility with all the food, all the required facilities. And on top of it, if somebody is exposed to COVID, we have to treat them. Unfortunately, some of our own brothers and sisters, they lose their life in the battle against the COVID. And hospitals also have to incur additional costs in the form of insurance cover for healthcare workers. Still, the health insurance from the government is not fully operational. So majority of the private hospitals, they take the brunt of having the insurance for healthcare workers. So put together, if you look at the cost, so I have specifically not mentioned any cost, but I can say it's much more than what we normally treat. At this point, we get very upset when somebody says that, okay, you just give only IV fluids, only vitamins, only normal food for the COVID patients, then why are you charging more? For them, I have to tell them, what I have to tell them is, yes, majority of them require not medical treatment, but a treatment, observational treatment in a safe environment. To provide a safe environment, we have to incur huge manpower commitment as well as huge infrastructural changes. I agree. The treatment part is less, but the treatment environment is more. And unfortunately, one among the few percentage of those patients require some sort of additional treatment like the oxygen, high flow oxygen. And even among those people, some of them may require ventilatory support. There again, the cost goes up. For ventilatory support, it's a 1:1 nurse. Intensivist should be involved. The entire environment again changes a lot. So they put together, we as a healthcare professionals get really annoyed when some people say that for just observing or for just ventilator support, you charge more. Now I can say no hospital is trying to make money. We are here to survive. We are here to withstand all the onslaught by the COVID and then try to get over it. So the COVID, it's not like just like I can say make hay by the sunshine. No hospital does that one, I can say, because hospitals are finding it difficult to offer the COVID treatment with the available doctors, available staff nurse, available infrastructure. So we are basically what we are doing, both public and more so private hospitals, is we are trying to tide over, trying to help all the public with whatever way. And these are some of the additional expenses which are not in our hands. So my humble request to all the people listening to this particular talk is, please don't ever think that hospitals are charging more. Yes, this is an essential thing, and huge amount of effort is there behind the scenes. Even to observe you with a pulse oximeter, with a step, with just a food and then the vitamin supplements, we need to have lot of background work, lot of shifts, lot of manpower, lot of people's lives are at risk. It may be just an observation or just an oxygen, just IV fluids, or maybe a ventilator support, whatever. The moment you are a COVID patient, huge amount of work is done at the background behind the scenes to make you safe, to make you recover. This particular thing, I think everyone should understand, so that the healthcare cost, the healthcare burden or the COVID burden on the hospital is split and then shared. We are definitely not, the hospitals are not here to make money. And if somebody does it, that's the worst thing. And we, either doctors or staff, are told we have the Hippocratic oath as well as the ethical, we have taken all the ethos, ethics, we practice ethics, and none of the healthcare workers will do, I'm sure. It's only the communication. We have to get it across. If somebody asks, yes, we tell them. And I also ask you that you can go and refer. Now it's everything is open. All the public limited companies, private limited companies, balance sheet you can analyze. This is a request to all the auditors or all who are in the Rotary and the other public. You can go and audit them. It's all in the open domain. None of the hospitals are in a very good position financially. Everyone is struggling, at least especially in this one. As Ratan Tata said, our job is to survive. It includes, it holds good for the hospital. We are there to survive, make all people survive, but also make sure that our hospital and our healthcare establishment survives. I'll take 10 more minutes to complete it. To compound the problems further, we don't enjoy any special privileges from any of the institutions. Just to make one point, we, the private hospitals, pay the tariff in the category 3. The charges are 8 rupees, almost 8 rupees. This is 2017 census. Imagine the industries, the registered factories, textiles, tea estates, IT services, they come under tariff 1A, which are charged less than our charges. So we are not even in level playing field. We are charged more for our own day-to-day running, including electricity bills. We're charging more. Industries, textile industries, IT industries are charged less. But just to make it a point, how we suffer. The private hospitals are charged one of the highest. If you remove the temporary supply, we are charged the highest category tariff for electricity. Be it electricity, be it any other services which we get it from the institutes, we have not been, there is no subsidy. Or for that, my worst scenario, as I can told you, we are charged the maximum slab. So we have to incorporate all these expenses into our patient charges, and then we charge the actuals. If somebody wants to give, I can able to provide the breakage of all the bills, so that it's all very fair and transparent manner. All the hospitals are working in this pandemic. And as I told you, hospitals are struggling literally. If you look at the hospitals, most of the nursing homes have closed for the want of doctors and the staff. All the clinics, a lot of clinics are facing closures. They are afraid to come because of the COVID pandemic, because of the safety measures. What's surviving is the hospitals which can able to muster in manpower, which could able to muster in infrastructural changes and then do it. And hospitals are three types. One, now completely converted to COVID hospitals. Second is the majority COVID hospitals, still they do little bit of elective works. And the third one category is like ours, where we restrict to non-COVID category because our infrastructure can be altered to offer elective patients with elective surgeries and elective gastroenterology and urology as well as gynecological work. These three category hospitals now work. Purely COVID, mixed COVID and normal patients and normal patients. So among these, lot of hospitals are struggling. Lot of them are already closed. So because of less patients, especially the category 3, those who are dependent on only normal patients, normal surgeries, normal procedures, they get less patients, they get less surgeries, less turnover, and as a result, doctors are taking pay cuts. It's the so far for our staff, we could able to muster in, but doctors who are especially for the fee for service as well as on a normal basis, they are getting less patients and they are getting huge pay cuts. This is the scenario in most of the hospitals. And you can see the pay cuts are not restricted to only private institutes. Even governments are finding it difficult. But what the hospitals are doing it is not only they don't generate for, especially for COVID duties, they are not cutting the pay. They are incentivizing people so that more and more staff come to work in COVID as well, because the environment is deadly. We have to incentivize, so we have to incur additional cost, and we at the same time we have to give the salaries in proper time, and for that also we are finding it difficult to get staff and as well as for the doctors. So as a hospital, we are feeling the pinch either from the COVID hospitals because they are not getting adequate staff to man the patients. Hospitals are running full. On the other hand, elective surgeries and elective procedures have come down, further contributing to the financial crunch of the hospitals. Whether it is COVID, non-COVID, or mixed hospitals, all three categories are facing difficulties. But life has to move on. Life, we have to continue our work. We don't have choice, because we we are in this profession. We have to somehow treat it. And people ask, there are other warriors like soldiers who work on the front line, who work in the either on the seas or on the mountains or on the cold climates. They also sacrifice. Yes, we respect those sacrifices, but the sacrifice what we made is slightly different. One, we when we go home, we might carry our COVID viruses with home, and thereby putting our life, families also in jeopardy. Second thing is, we as a warriors are trained to fight the disease without affecting us. Majority of the time, we have adequate precautions. Soldiers are trained to fight, to sacrifice their lives. But whereas we are trained to treat the disease. This is the disease which affects both the patients as well as the healthcare workers alike. It doesn't make any difference whether you patient or a healthcare workers, they are both equally at risk of getting the disease equally. But still we are working with great uncertainty. What will happen to both? Am I going to get COVID? I have a lot of friends working in the both public and private, who are really risking their lives day in and out. I get patients. Sometimes they get positive after some time, or when at our hospital we test for COVID, and there again there is also a huge cry. Why should you test for COVID when the patient is normal, when we are subjecting to surgeries? Again, the patient, if they come to know about the status of COVID after surgery, if they're COVID positive after surgery, the entire surgical work goes waste. 40% their lives are at risk. So we don't really do any unnecessary investigations which are necessary. We do take precautions, and in the bargain we have to incur additional cost, and that we diligently try to share, try to avoid. But at the same time we have to really make some hard choices, like working. As you can see, in spite of COVID pandemic, our life goes on with all the protection. We continue to work, we continue to operate on cancer surgeries, continue to operate on emergency surgeries with the protection, of course, but the protection is not 100%. Even with all these gadgets I have shown, still people continue to contract viruses. We don't know where we lack, but definitely it's not 100% foolproof. If I go with all the things, still I don't know whether I'll get a virus. So we continue to work, and in this particular time of abnormal situations, pandemic situations, what as a healthcare worker we expect in return is just support us. No rumor mongerings, just encourage us. Even if you don't encourage us, it's also okay. But what the healthcare worker expect is even not even to recognize their work, but just stay with us, be with us, and then let's play our role diligently. We continue to treat it, and you continue to be safe. Be safe at home. Be safe in the form of maintaining for social distancing. Wear mask. Whatever the guidelines the doctors and the government says, please follow. And in spite of that, if somebody gets it, we are here to treat, either for non-COVID patients or take for example our situation where we treat non-COVID patients who require surgeries, who require other emergencies. Emergencies can come at any time, even for COVID and non-COVID patients. So there are healthcare workers who are looking at you, who are really looking at treating those patients. What we expect is just a cooperation from your side, not to criticize. Even if there are criticisms, it should be in appropriate forum, not to sensationalize anything, any small lacuna, because healthcare system is a complex one. There may be some issues, and sensationalizing, just spreading the rumors definitely will demoralizing the healthcare workers. So my humble request through this forum, I have to thank the Rotary Bus, is to make people understand that we are fighting the war together with the healthcare workers, and hospitals, both public and private, are there to help in overcoming this COVID pandemic. Nobody is making any of the personal favors. So all of us should be stay together. And this is my last slide. My take today is, let's fight COVID together. It's not only from your side, or it's not only from our side. It has to be from all sides. We have to tackle it, because pandemic means it has its way to find through to across the countries, across the boundaries, to affect the entire world. So we are fighting an invisible, a powerful enemy, and any letdown either from either side will be yeah, I mean, it's a good thing. I mean, good thing for the COVID, so that it will stay for long. If you want to get rid of that one, we have to come together, have a constructive work, follow the guidelines, as well as take all the precautions. And even in the case of treatment, we are there to treat you. So with this, I also like to acknowledge my own team, Dr. Palnivel, our chairman, GEM Hospitals, Dr. Ashokan, our CEO, who has got a lot of knowledge in helping me to prepare this particular talk. The entire doctors and the staff of GEM Hospital in all the 5 cities with which we operate. I have to compliment that the entire workforce, like in any hospital, I have to compliment my own staff. They don't have any hesitation in fighting with us. They are there. Imagine, for the last 4 months, the people who are working in there, because we ask them to stay indoors, stay in the hostel, so that they don't go out and come. They have not seen their families in the last 4 months. They have not gone home. So they have to be complimented, they have to be appreciated, they have to be encouraged in this fight. So I really compliment and thank them, because it's not a one-man show, it's the teamwork. Doctors, staff, all the paramedical workers who work with us in eradicating and providing quality healthcare in these tough times. So with this, and once again, I thank the Rotary Rotabus for giving me this opportunity to share some of my experiences and some of my thoughts on what's going on in this healthcare industry. Thank you very much.
Thank you, Dr. Senthilnathan, Rotarian, for the inspiring, very strong message and interesting overview about healthcare statistics in India and when comparing with the rest of the world. Hats off to you. Hats off to all the healthcare workers around the world, not only in India, not only in Sri Lanka, for risking their life and saving. We Rotarians, we are there with you, and that assurance is always there. And you as a Rotarian, I'm sure you will definitely believe in us, and we're doing so. And I think Rotary Foundation also has granted $4.7 million as a grant towards this pandemic, and we are all proud to be with you. Hats off to you, and round of applause to you, Doctor. And it's time for question and answers. And there is in the chat box another Rotarian, another surgeon who is running a hospital from Haryana, India, who would like to share his views. Is Rotarian Sanjay Singla there?
Yeah, he's there.
Yeah. Can you unmute yourself and give your thoughts, please, Doctor?
Oh, thank you. Thank you so much. Hello, Centennial.
Yeah, very good evening.
I'm a general surgeon interested in laparoscopy, especially colorectal, and working in Haryana. And I run a small hospital, 15-bedded hospital, my community hospital, for a town of around 3 lakh population. I want to share that when the things broke up, there was all despair and shock, and we just remained shut down for almost 15 days earlier. But then we started opening, and I want to share my sentiments along with the Sentinel that yes, it's a really tough time for the hospital also. Today I was calculating that last year we operated 136 patients in these 3 months, and this year we just could operate only 36 patients. So you can understand the revenue problems. We have not shunted down any of our employees for the last 3 months, and we have given a salary of around 11 lakh rupees to these employees. And the hospital generating almost 1/3 what we were used to, not even 1/3, almost 1/4 what the hospital used to generate during this time. So, but we still understand that if we are able to keep ourselves safe and our community safe, and I can give services of coloproctology to my people, and we can live for 1.5 years till we get some vaccine or something like that out of this pandemic, I will think that we have won the game. So the people should understand that even small endoscopy for a hematemesis if patient comes, the cost which was earlier, now it is almost three times the cost for PP and other things, as already told by Dr. Sentinel. So my message is that please, please, please bear with us. We are also in a real tough time. No one has seen that pandemic of this magnitude in our lifetime. We are all less than 100 years and we have not seen it. So this is for the first time we are facing such problem. So me being a Rotarian, me being a past president of this area in the Rotary also, I really appreciate the Rotary effort to bring this to the focus. And I will love that you please spread this message that by and large, the hospitals are not fleecing anything. Hospitals are not overcharging you. What changes we have done, we have published in our book, ebook from Haryana also, that what changes we have to do. We have to train people, we have to what and what not. We have to change everything in our hospital. So in operation theaters, everywhere, to give services. We just now today, I cannot just stand up and go to the OPD and see one patient and come back. If I am to go to examine one patient, I am to put every gear. I am to put every PPE so before I can go there and examine one patient. So we have not increased even charges. We were used to charge only 300 rupees for our outpatient. We are still charging 300 rupees. If we are doing any operation, we are still charging the same, just telling the patient that it will cost 5 PPE kits for this surgery. You have to pay for those 5 PPE kits, and you have to pay for your COVID-19 RT-PCR test. That's all. To tell them, frankly, we'll tell them transparently that you have to do this much extra for this cost. We are not overcharging at all. So please convey this message to the public from the Rotary front that please bear with us. It's a tough time. We're also in the same problem, revenue problems, economic problems, then a fear of unknown fear or a known fear of death, a fear in the family, a challenge never seen by the family also, emotional problems with the doctors' families. And it's a real problem. We have to understand that. Thank you so much to allow me to share my views. Please convey to the public that please, 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 we are not their enemy. We are their same friends. We are same people. We were working earlier also, and we will not overcharge them. Not at all. Thank you so much.
Excellent.
Thank you, Doctor. Thank you, Doctor. We'll stand by you. House is open for questions. If anyone has question, can kindly rise.
Our DGND Muttanachi is having a question. Anna, unmute panni kelunga, please.
Dr. Senthilnathan, ரொம்ப நல்ல அருமையா சொன்னீங்க. You explain things so well. See, here in Tamil Nadu, here in India, the film industry has painted a very negative picture for the medical professionals as well as any other leading industrialist, you know, the industries, etc. They always project in a negative way. But I don't think we should be concerned about that. But ultimately, people know that there are good people everywhere. And unfortunately, there are people who are not all right, you know, in any and every profession. Do you agree with me that? See, in our industry, we make edible oils. Not all the manufacturers are sincere. There are some who don't go by the discipline, you know, who do the way they want, you know. I mean, the question of adulteration and issuing oil without bills, that is black marketing, and all that is happening. My point is, there is always a percentage of people who are not doing it right. Is it what I say, is it, shall we say, it is the same thing in the medical profession, where there are certain people who are all having the malpractices or whatever that is. What is your observation on this?
So thank you for asking me very straightforward, point blank. So first of all, I like to clarify, no doctor will treat you wrongly. So that's the basic ethics. If say a fracture has to be fixed, or a tumor has to be removed, or if a medicine has to be given, no doctor, see, in your thing you adulterate. There is an, you have first quality, second quality, or you can do like this. But in medical profession, the ethics says that do no harm. That's the Hippocratic oath. Just we will not be doing any harm to the patient in the first go. So I want to make it clear. So no doctor in any country will give, to his knowledge, in the sense, the intentions are very clear to treat the patient, to cure the patient. In that way, this profession differs from the rest of the profession. We cannot question the intention of a treating physician. That's loud and clear. We always try to treat it. But the other circumstances come into play, like the charges. So now I can say in two aspects, people are losing faith in doctors. One, if you look at the previous 20-25 years, we used to have a group of doctors called family doctors. So we always go to the family doctor first, and whatever he says, we obey. Still in UK, that system is there. It's called family physician. You cannot see a specialist directly. Here in India, we can walk to any big hospitals and see a super specialist. That super specialist, you have not seen them before, you have not heard them before, and then he is offering the treatment, and you have some suspicion whether that particular doctor is right or wrong. Rather, the time-tested method, you first go to a family doctor. He refers to a general specialist, and then he refers to a super specialist. If this chain is maintained, then you wouldn't have lost the hope. Okay, நமக்கு தெரிஞ்ச டாக்டர் தான் சொல்றாரு, அவர் கரெக்டா தான் இருக்கும் அப்படின்ற அந்த faith இருக்கும். So on the faith வந்து இப்ப இல்ல. We are seeing unmet doctor, a strange doctor, whether he says correct or wrong அப்படின்றது வந்து, that's the first thing. The second thing, as I told you, when we try to create an infrastructure, it comes with a cost. That cost, unfortunately, it's beyond our control. If you look, if you go high up in the ladder, our hands are tied. In a corporate hospitals, because of the so much of the establishment charges, the doctor's role is less. So people think that doctors are making money, the charges are higher. So on these two counts, I think the faith in the medical industry is coming down. So my take is, we have to bridge this one with proper communication, try to develop a concept of community or family doctors, so that we again recreate the trust. As Ramya said, my father used to practice, and he used to have a spiritual relationship with the patients. Now that particular thing is not at all there. But definitely we cannot find fault with the doctors for this. It's a society that evolves by itself because of various factors, and this is the reason. If we want to change, the entire public and the doctor have to change. So develop a habit of family physician, and try to understand communication is important. Why these costs? But you can get the second opinion or third opinion. Be open, either from the patient side or from the doctor side. The communication has to be open. If these two things, communication problems and the faith in the doctors, are addressed, I think rest of the things can definitely, we can recreate the faith. Only thing, and I reiterate, no doctor will treat wrongly. There may be deficiency in services. நம்ம ஒரு இன்ஜெக்ஷன் போட சொல்லி போயிருப்போம், டாக்டர் இதை ஸ்டாஃப் போடாம அவங்க வேற ஏதாவது லேட்டா பண்ணிருக்கலாம். Or now when I think, that's an error of judgment. When I think something and if the patient is not responding, that is also not fault. I am applying my mind, but patient and the disease need not listen to us. அது வேற மாதிரி ஒரு கோர்ஸ்ல போயிட்டு இருக்கும்போது, then problem comes. Even then, if we explain it to the patient properly, they will understand. So basically, communication and the faith irundhudna, I think majority of the problems, the lack of faith, lack of understanding, we can overcome.
Thank you.
Thanks, Doctor. Before moving on to the next two questions, We would like to recognize the presence of DGND Navin Gulati. I don't know whether he's still there. He was there a while back. And also we'd like to recognize the presence of Chairman of GEM Hospital, Dr. C. Palanivelu, who is also with us now. Moving on to the questions, DGND Pubuduri Soisa from Sri Lanka would like to share her views on the healthcare system in Sri Lanka. Over to you, DGND Pubudu.
Thank you, Dinesh, Dr. Senthilnathan and the team. I thought when I was listening to your, the great story and very emotional, I must say that, and hats off to all of you, healthcare officials, healthcare workers. We have the same situation, but it's a bit different. So I thought I just must share, for our Indian friends to know what we are doing in the country. Although I'm not a medical professional, I'm an engineer, but I work with Ministry of Health for last 6 years, and I must tell you that our system is a bit different, or rather opposite to your system. We at the Ministry of Health to Sri Lanka, so far we have not actually opened up for the private sector for this treatment. We actually thankful to all people of Sri Lanka, whether it's administration or the general public, assisting the government to provide this great service through the government health systems. So actually we had the blame from the private sector. We are not opening up for the private sector. Purely, our health officials, the government believe that this blame game will come, whatever the cost, it is mainly the cost. So therefore, I guess we could not have anything, given it to the private sector. Thankfully, thank God, we thankful to everyone, not only Sri Lankans, but friends like you sitting in the other parts of India. The rate of the discharge or the patients who get discharged around 1,700 versus the patients who actually, the COVID patients are around 2,047. It's almost the same, and also the deaths are controlled at very minimal level, thanks to all the healthcare officials, whether it's starting with the ambulance driver up to the, the consultant, virologist, or the doctors, all the administrative, our country administrative. So I must tell you that our story is a bit different because we made a very small country, 1/20th size of yours, and we have a very, very tightly knitted healthcare system, and the healthcare spending is much, much more higher in terms of GDP. So I believe that is because we are a very small country compared to India. But I'm thankful to once again to all of you, the Rotarians, the doctors, what you are doing, the noble, the actions. May all of your families, all of your friends and the staff and every one of you be safe. And let's, be back in new normal to continue our good work in Rotary. Thank you.
Thanks, Pubudu. Is Rotarian Venkat from Tiruppur in for the next question?
Hello. Audible?
Venkat, yes.
Okay. Yeah, good evening to everyone, and especially to Dr. Senthilnathan. Really, it is paining when you are delivering the speech. We, the Rotary community, definitely is behind the doctor community. As you said in your first slide, all the people are behind the doctors and they are appreciating. Even today, we are appreciating you, the doctor community. So we are with you, Dr. Senthil. That I just want to make that with you. Because we normally all the doctors always be in the Rotary organization. Why? Because they just want to let out their pain in the Rotary movement only by participating with so many people. Likewise, you came to this Rotabus, and really your pain will be eased. And we, the people, definitely behind you to take this message to all the people. That is number one. Number two, I just wanted to convey one message to all the people over here. One of my friend doctor is having 2 child. Yeah, because he is running a hospital, he could not able to see the childs over there daily. So he just put the people over there in the room. They just open the door and see the childs, whether they are safe or okay. All the food and everything was taken by them inside the room. The people will give, and they are enjoying only in the room only, not coming out. Such a pain. We are hearing so many stories. Just I am sharing one of that. And another important one I just wanted to ask. In the beginning, you have mentioned about the percentage of the expenditure was done by Delhi is 12.5%, if I am right. But whereas in Tamil Nadu, it was only 3%. But still, this COVID-19 pandemic was higher there in Delhi. Is it any connection in that figure, or Tamil Nadu wants to take more? And sorry, one more question I just wanted, because further I don't want to disturb other people. You are talking about the.
Can I ask one question?
Please, just
Sir.
1 minute. Just 1 minute. We are in number 57 stage all over the world, but still our death rate was very less. Is it really we are treating the COVID-19 patients in the right way? Thank you. That's what all my questions. Thanks a lot.
Thank you, Mr. Venkat, for asking a couple
Sir.
of very valuable. Oh,
Sir,
please.
this is.
I think
Hello, sir.
You are not audible.
I want few words from Dr. Pallanuvelu sir for us. I really think he is 2 fingers short of God for us and in the society also. So please, we want his words to hear us.
Yeah.
Sir, please.
I'm enjoyed the talk all this time, and listen to Rotarians and this, and I'm very happy. I'm also Rotarian, and this time I have to say a few words about this. That Corona made it a panic among all the societies. Initially, government was forcing us to postpone the elective work because that they were anticipating a lot of people may come. They have to take the emergency care of the Corona pandemic. That time where we are postponing elective just because government request, and later government insisting that government hospitals can go taking all the treatment because essentials you can't stop now. Now some of the people have got a panic. Go to hospital. Oh, if you go to hospital, will you get the Corona? Because the people are coming to the hospital, no? So there is most potential area getting infection likely to be hospital. That's why a lot of people don't try to come, afraid. But truly, all the private hospitals, if you go, they've changed the complete entire systems now. And a lot of relatives will used to come, but we don't allow everybody to go inside except patient one relative. Outpatient and isolation ward are all separate, and the regular work is going in a separate place. So no one will get infection, no fear of this. And society should come to know, going to hospital, and they need not worry about it because all safety measures have been taken by the hospitals, and government has given, ICMR has given guidelines how to go about safely. Nowadays, we go to hospital, I'm able to see the trees surrounding the hospitals are full of relatives sitting it, enjoying it under the trees. Because relatives all cannot go inside because we want to save for them, and that's way it is. Now, those days, cancer, these type of surgeries, people thinking whether to go surgery or want to go different type of. No protocol changed. Any treatment, any disease, what we are doing before Corona, same thing we are getting it. That's why it is all safety measures be taken. I think Rotarians are there, and a small appeal is, and of course, too much panic. Everybody try this. Always accident can happen. Doctors have to take precaution. Have to go. We are taking. Virus was going on, coming. It is not the Corona. It is a lot of things came. Luckily, there was some vaccine. We have some protection going safely. But Corona is a different kind of. We still don't know a natural or unnatural virus. The vaccine is still not in that place. So till vaccine comes, we have to be afraid. We have to take precaution. And I think it is understood. It is always a problem will be there. We have to take care and go. And thank you very much for asking me. And so already it's been discussed, and leave to the forum that go discuss. Lot of things to be discussed later. We'll come back, some manual, something different. But government is doing very well. That question was asked, but death rate is very less. Yes, and compared to all the world, in India, Sri Lanka has shown death rate less, because we are searching the patients, going, picking up and testing. Most of them are asymptomatic. Most of the contact patients. And we are taking at the care itself. That's why the diabetic, hypertension, old age people, or who is already taking a steroid for asthma or some immune problem. And those are the people likely to. That's why government advising not these people, aged people, not to go out, and risk patients not. So proper guidelines to follow, and people, everybody, in spite of 2 months of threatening in the news, until a lot of people I'm seeing that market, they go together, they're going without mask, they're going. And when they're standing in the shop, they don't bother about the social distancing. And every one of us has to teach the people, no, they have to follow. Everybody, our life is more important for us. That means, why should we go nearer to other people? At least, that distance we'll maintain. So Rotary as a movement, now they can take a message with people, talking to the public. Social distancing is the most important thing. Second, hand washing is more important. Never touch, like this. And mask is very important. These 3 things they follow. It is mostly we can prevent this infection. After all, this is an infection virus. It will die within 2 weeks, if you properly keep it away. So that's why it is within our hands, and people has to become disciplined, and everybody has to be careful by their own life. And if we don't discipline, then it will continue like this. The reason Tamil Nadu is facing because of crowded housing people at Chennai. So all of us will teach the people social distancing, hand washing, and mask. I think that message, Rotary can take it through all the clubs, all the places, whatever form, with the pamphlet or mic or something like. And the government, whatever says, police says, people don't know, they are escaping it. If we say that, and people may listen to the public. So that's why very important media, Rotarians can jointly. Thank you very much for the few words.
Thanks, Doctor. Past President Selvakumar has a question. Before that, we welcome DJND Satish from RID 3160. Selvakumar, are you?
Yeah. Good evening, Doctor. எனக்கு ஒரு சின்ன டவுட், நம்ம இந்த கோவிட் பத்தி இன்னைக்கு ஒரு மெடிசின் ஒன்று வந்திருக்குன்னு சொல்லி ஒரு பேப்பர்லாம் வந்திருக்குது, வேக்சின். அது ரியலா, அது ஏன்னா இப்ப எந்த நியூஸ் வந்தாலுமே அது வதந்தியா நமக்கு பயமாக இருக்காதான்.
கோவிட் அந்த வேக்சின் வந்து I can that vaccine now, that's the first vaccine to be tested from India.
Okay.
In European countries, some of the vaccines are now under testing, including UK. Okay. This is the first indigenously developed vaccine which is to be tested in volunteers, so that we'll come to know the results few months later. That may or may not click. Hopefully it clicks, and then we should be the first country. We all should pray that India should be the first country to provide develop very effective vaccines. Now at least 50-60 vaccine trials are underway, or at least in labs which are waiting to get approvals. So one such thing right from in India, it's getting approved by the ICMR for mass testing. So we should pray that it should go well.
What will be the exact cost, approximate cost?
No, that all depends on the type of vaccine, whether the mass production can reduce the vaccine cost. But by and large, most of the vaccines are affordable, fortunately.
Sure.
So we no need to worry about the vaccine cost.
I think I'll answer this part. Okay. And this is a pandemic, government has put a control. Like COVID testing in government institution, totally done by free of cost.
Yes.
Similarly, this is a government is going to take it as its own issues. Once it is a success, then it is India is always vaccine world leader. We are the Indians, manufacturing or sending it to all the world. So Indian now central government or state government, ICMR, very keen.
If it is successful, cost, I don't think it is going to be a problem. Indians always shown cheaper and mass production. It will come.
Sure.
So I think once successful enough, cost is secondary. Life is more important than that part. No, very.
Thank you, doctor. Thank you.
Well said, doctor. Well said, doctor. I think we have run over time. I think after a long time, so much of question that shows the interest in the topic and interest in the speakers.
One second, please introduce our DGND Muttanachi to doctor. Anachi, நீங்க unmute பண்ணிருங்க. Anachi, டாக்டர் ரொட்டேரியன், கோயம்புத்தூர் ரொட்டேரியன் டாக்டர்.
நீங்க சொல்றது டாக்டர் பழனிவேலு இல்லையா?
ஆமா ஆமா ஆமா.
டாக்டர் பழனிவேலு, உங்களுக்கு என்னுடைய வணக்கங்கள்.
வணக்கம், ரொம்ப சந்தோஷம். நான் கையில செல் வச்சிருக்கேன், கையில எடுத்து கூட காமிக்க முடியாது.
நோ ப்ராப்ளம். என்னுடைய பெயர் முத்து. நான் விருதுநகர் இதயம் நலனை எங்க தயாரிப்பு.
ஓ, வெரி குட், வெரி குட். ரொம்ப சந்தோஷங்க உங்களை பார்த்து. நீங்க கேள்வி கேட்கும் பொழுது பார்த்து ரொம்ப அழகா கேள்வி கேட்டீங்க. வெரி நைஸ், வெரி ஹாப்பிங்க.
இல்ல, என்னோட கருத்து குறிப்பா என்ன அப்படின்னா, பிலிம் இண்டஸ்ட்ரி எப்பவுமே நெகட்டிவா எல்லாரையுமே பெயிண்ட் பண்றது பிலிம் இண்டஸ்ட்ரியோட வழக்கம். அது இண்டஸ்ட்ரியலிஸ்ட்னாலும் அவங்க குறை சொல்லுவாங்க, டாக்டர்ஸ்னாலும் குறை சொல்லுவாங்க, இல்ல ஆர்கிடெக்ட்னாலும் குறை சொல்லுவாங்க. குறை சொல்லி அதை வில்லன் நடத்துவாரு. அவர் பொண்ண ஹீரோ காதலிப்பாரு, ஹீரோ லோஃபரா இருப்பாரு, தெருவுல சுத்திட்டு.
அது நம்ம அவாய்ட் பண்ண முடியாது. இந்தியன் பீப்புள்ஸ் கொஞ்சம் சினிமானா கொஞ்சம் இம்பார்ட்டன்ஸ் கொடுத்து பழகிட்டாங்க. மீடியாவில் பிரேக்ஃபாஸ்ட்ல இருந்து அவங்க என்னென்ன பண்றாங்களோ காலையில நைட் வரலும் மீடியாவில் அவங்களதான் காமிச்சுக்கிட்டே இருக்காங்க. ஸோ பீப்புள் பிலீவ் தம். பட் என்னைக்கு மக்கள் அது இல்லை அப்படி உண்மை இல்லைன்னு நம்புறாங்களோ அன்னைக்கு தான். அது வரைக்கும் நம்ம கஷ்டப்பட்டு தான் அவங்க தலையில என்ன பண்றது. நம்ம இந்தியாவில தான் பிராக்டிகலா, அமெரிக்காவில ஜப்பான்ல சினிமா ஆக்டர்ஸ் எல்லாம் யாருன்னு கூட தெரியாது. இங்க அப்படி அவங்கதான் செலிபிரிட்டிஸ், என்ன பண்ண முடியும், அதுதான் ப்ராப்ளம்.
சார், பிராக்டிகலா பாத்தீங்கன்னா இன்னைக்கு ஜிஹெச்சுக்கு போறதுக்கு யாரும் தயாரா இல்ல. பிரைவேட் ஹாஸ்பிட்டலுக்கு தான் போகணும்னு நினைக்கிறாங்க. அது மட்டும் இல்ல, கவர்மெண்ட் ஸ்கூலுக்கு போறதுக்கு யாரும் தயாரா இல்ல, பிரைவேட் ஸ்கூலுக்கு தான் போகணும்னு நினைக்கிறாங்க. சோ பிரைவேட் செக்டாருக்கு நிச்சயமா நல்ல மதிப்பு மக்கள் தராங்க. கவர்மெண்ட் ஸ்கூல்ல வாத்தியாரா இருக்கிறவர் அவருடைய பையனை பிரைவேட் ஸ்கூல்ல சேர்க்கிறார். That is the order of the day.
அது ஒன்றும் கஷ்டம் தாங்க. அது ரொம்ப மாறுறதுக்கு டைம் எடுக்கும். All of us have to try, work for it. I think Indian system democracy. Anybody can talk anything, anybody can do what they like. And சினிமாவில் இன்னைக்கு தான் ஒரு இடத்துல ஒரு நல்ல பேசினாங்க. எங்கேயுமே பாருங்க, அந்த ஹீரோங்கிறவங்க எப்படிப்பட்ட ஆளு வேலைனாலும் ஹீரோவை காமிச்சோம்னா அவங்க உண்மைக்கு ஒரு லைஃபுக்கும் சினிமாவுக்கும் சம்மந்தமே இல்லை. ஸோ அதனால இது நம்ம கவர்மெண்ட் பாலிசி மாறணும், நம்ம மக்களுடைய எண்ணங்கள் மாறணும். முதல்ல எஜுகேஷன் சிஸ்டமே அந்த நாலேஜ் லேர்ன் பண்றதுக்காக இருக்கணுங்கிறது, டிகிரி மாறணுங்கிறது வரணும். பார்ப்போம் எல்லாமே. ஆனா இப்போ சேஞ்சஸ் நடந்துகிட்டு இருக்கு. ஐ ஹோப் சூன் கொஞ்ச நாள்ல நம்ம இந்தியா மாறினா நல்லா இருக்கும்னு சந்தோஷம்.
No, but sir, we are the people, we are making them hero. They are not actual hero. I think you are real hero for the society, not for surgeon.
What to do, no? But so media makes them, see, simple example I'm telling, no? Whole world is changed one black. And America, the black fellow is over 3-4 times arrested, druggist, all criminal guy. The police 2 people made a mistake, they also killed him on the street. These 3 people are nothing to do. That police people were punished. But the entire world is making a hero of that druggist. That is media in America made it, no? This is where that today, very difficult. Media is becoming a private, making a money, rating system. So you and me, whatever we do morning to night, and we can't expect anything recognition. We have to work for the society. Happiness comes that way. That's why we say this time, in spite of, I'm also Metropolis Rotary here, and I took it a care for life as a free cancer surgery, doing it free of cost. And even Corona time, we did it 3 patients. Rotary all were recognized in Coimbatore. Happy. That's why, government is going to come recognize these things. Very nice. And we're looking at you all the days.
Thank you. Let us recognize ourselves, and can we have a round of applause to all? Can we unmute all, please? Host, can we? This is for all the people
Thank you.
who are on the
next
cost
week
saving list.
next week announcement.
Yeah.
Next week we are having Mrs. Radhika Ramasamy as our speaker. He is well-renowned wildlife photographer from Tamil Nadu. He's basically an engineer turned into a wildlife photographer. Please stay with us on next Tuesday evening, 7 o'clock. Thank you.
Adding on to it, I was told by Rotarian Selva Kumar, there are about 7 clubs, only women, all women clubs are joining. So all men are welcome to join the forum, I guess. So over to Rotarian Ravi Kumar to formally thank, express the thanks, please. Rotarian Ravi Kumar.
Ravina, you can mute, please.
Thank you. Thank you, Rotarian Dinesh, giving me an opportunity to propose a vote of thanks. Thank you. Good evening, all. So this is a joint initiative program of Chinnasalem and Coimbatore TexCity and Colombo, Centennial, EastCoast, Ramnad, Madras Mount, Pondicherry Galaxy, Tiruppur East, Tiruchirapalli Phoenix, Vellore Record. Thank you for all these 7 clubs and representatives and Rotarians from these 7 clubs. And we special thanks to our today's chief guest, Rotarian Pupududi Joysa. Thank you, ma'am, for your wonderful presence here for a wonderful evening. And our special heartful thanks to Rotarian Dr. Senthilnathan from Coimbatore, our own native Coimbatore place. Thank you, sir. Wonderful sharing you have today. Really, we are muting of this meeting with with a lot of thanks. You people, healthcare peoples, working for us. Really thankful, and we feel your pains. Really, we appreciate your efforts toward the society. Thank you so much for your kind words today. We realize you are all health on behalf of all healthcare people. Thank you so much, sir. And we recognize and thankful to the chairman of JM Hospital, Dr. Palani. Sir, thank you, sir. Thank you for being with us this evening. And thank you, DG and Muttanachi. You won't miss any meeting of our Rotabus. Thank you for sharing your thoughts and being with us. And 2 more DG and Ds from Colombo. Thank you all. And thank you all from all Rotarians from various districts joining us this wonderful evening. Thank you so much. Thank you so much.
Thanks. And thanks to the 4 DGND present here who are going to be DGN tomorrow. All the very best. And let us adjourn the meeting. And until we see you again, have a pleasant evening. Good night. And see you in 2021 Rotary year.
Thank you. Thank you.